Hi and welcome back. I want to say thank you to everybody who's already viewed, liked, and subscribed to the channel already. I really appreciate you. I do want to make sure that I am following through with the things that I gave you the introduction about. So today's video is specifically going to dispel the myths of the mental health profession as a whole. And so what I mean by that is I'm going to give you a rundown of different designations of the mental health professionals that are in the field of mental health and just kind of give you an idea of what each of those designations mean. One of the reasons that I want to go ahead and do that is because I want you, if you are dealing with a specific issue or if you might even be searching out a mental health professional, I want you to have a greater understanding of what it is that you're looking for. That way you can make a little bit more of an informed decision. I think a lot of times when we have clients that come in and they're looking for somebody, they kind of just pick what seems like the right person. And one of the things that we don't really know or realize or understand is that, not every mental health professional is going to be able to work with every single client. And so you may not be a good fit for that professional. That professional may not be a good fit for you. So it may take a little bit of homework to get the right fit. So let me go ahead and give you a rundown of the different designations, what some of the differences are, and then we can kind of move from there. Okay. So you have your LPC, which is your licensed professional counselor. You have your MHC, which is a mental health counselor. You have designation, which I have, which is an MFT, or a marriage and family therapist. You do have your psychologist, your psychiatrist, and you do have some other mental health designations as well. So you have certifications for various addiction counselors, CAC, and so on and so forth. You do have certifications and other specializations that some other mental health professionals may have. Okay, so some of the main ones: LPC, MHC, MFT. You do have your social worker, so let me not leave out your LCSWs or your LSWs. So those are going to be your licensed professional social workers, or licensed clinical social workers, and then your licensed social workers. And so I'll give you a little bit of a designation or understanding of what those differences are right there. So your LPC, your licensed professional counselor, and your MHC, mental health counselor, is going to have a little bit of a different training than what I have as far as MFT, or what your psychiatrist, psychologist, and social workers have. So let me make a distinction right here between psychologists and psychiatrists. Your psychiatrist is going to be somebody who has an MD. They are doctors, medical doctors, who have a specific designation in mental health. So they are allowed to write your prescriptions, follow up, and give you management and medication, and help you understand your medication. They're pretty much, other than a nurse practitioner who has a designation in mental health, so your mental health nurse practitioners, the mental health nurse practitioner, your psychiatrist, those are going to be the two designations that are going to be able to offer you medication and medication management. Your psychologist is going to be that professional who is able to give you very specific assessments. So their key training is in testing, assessing for various diagnoses, and pinpointing and offering those diagnoses. They're not going to be offering any medication or prescribing any medication. And a lot of times they're not going to be offering you actual therapeutic services. So they're really just there for the testing side of things, and they're going to pass that information along to either a psychiatrist or the therapist that you choose and that you are working with. Your LPCs, your LSWs, your MFTs, your MHCs, and your various addiction counselors. Now, these are going to be the persons that you are going to work with on a continuous basis. Those are the people that you're looking for that are going to, and yes, all of us can offer you diagnosis as well. We can bill your insurance for diagnosing you, those kinds of things. Again, however, our viewpoints, the way that we see the case, the client, the situation is going to be a little bit different based on that designation. Again, the training is just a little bit different between each of these designations. With your LSWs, meaning your social workers or your licensed clinical social workers, and your marriage and family therapist, we are the two designation of mental health professionals that really kind of look at a family system. Even if you're presenting to us as an individual, and as an individual, you're dealing with maybe depression and anxiety, we are still looking at you in a little bit more of a what we call systemic, or what I'll call a holistic viewpoint, meaning we are looking at all of those various things that are a part of your world that compose or comprise what's going on with you. So we're looking at your work life situation, we're looking at your home life situation, the various relationships around you. We are looking at all of those different aspects of your world that make up you. When you have your LPC, your MHCs, yes, a little bit more today than previously or historically. We are finding more and more designations of mental health that see the value of systemic thinking. So they are attempting to integrate and embrace this idea of persons being systemic, or persons having a more holistic way of being. So while that is true, that these other designations are starting to accept that those theories, their training and the history behind their designations still doesn't give them the same viewpoint or the same worldview as your social workers and your marriage and family therapists. So therefore, an LPC or an MHC, they're going to view your situation, they're going to view you and your presentation just a little bit differently than would the other designations that I mentioned a moment ago. So that being said, depending on what your specific issue is, or what it is that you're wanting to present to your mental health professional, you may want to do a little bit more homework around their designation, their training, their background, and what it is that they can bring to you. The other thing that I mentioned a moment ago about our designations is that you may find mental health professionals that have additional certifications, additional training, additional specialty areas. For instance, I personally have a very huge passion in working with children and adolescents, young adults, that population. And what I've done in my training, and what I've looked to do, is to allow myself more information and training around what's called play therapy. Now, when you look for a play therapist is somebody who has spent a lot of time and a lot of energy in figuring out how to intervene in that person, that family's, that child's life using play. One of the reasons play therapy exists is because you had a group of professionals who realized that play is very natural for children. And children tend to play out what they see on a consistent basis. And so what we've learned how to do as play therapists is we've learned how to assess and in some ways interpret what that play is. So play therapy does encompass a lot of areas, so I just want to put that out there. So you have various persons who are art therapists, or they're into movement, so you have like almost like a dance therapy. Nowadays we have what's called equine therapy, and so they're bringing animals, so you have animal assisted therapy. The equine is horses specifically, and then animal assisted is going to be usually more puppies or dogs. So we do have all of these different things that fall under the umbrella of various forms of therapies that can be utilized as interventions, utilized to help you through whatever it is that you're dealing with. So these are some of the basic designations, some of the basic certifications. Again, I did mention your addiction specialist, and so they are going to specialize either generally as an addictions counselor, or you have those who are specializing in specific forms of addictions, like maybe a food addiction. You do have those therapists out there who specialize specifically in food. You have those who specialize specifically in substance use, and you have those who specialize specifically in sexual addictions. So all of those things being said, you have these various designations. Again, I do advise that you do a little bit of homework so that you can find the therapist, the professional that's going to be best suited for your particular situation. And I do have to say this again, not all therapists are a good fit for every client, not all clients are a good fit for a specific therapist. And so feel your way out and see after 1 to 2 sessions if it is that you feel like you have a good rapport with that therapist. Most therapists are going to want to build relationship with you from the assessment moment. So what I mean by that is whenever you contact that office or contact that therapist, they are going to ask you a series of questions to try and get an understanding of what is happening for you, what your experiences are, and how they can best suit those experiences. They're going to be trying to build relationship with you from that very first moment that you contact them or from the moment that they contact you. You'll know immediately if your personalities are clicking or not. And what I want to tell you is if you're not clicking with a specific mental health professional, don't give up on mental health or saying that, it doesn't work. Maybe you just didn't have the relationship that you needed with that particular professional. So perhaps try another professional under that designation that you sought out that you click with just a little bit more. Also, before I end the video, I do want to mention that your counselors and your therapists do usually have a little bit different of a viewpoint in the sense that sometimes you may get a little bit more advice giving from your counselor. So if you're seeking out more of that advice giving type of feel to your therapy, then a counselor may be somebody that you're looking for. If you're looking at working through what are some of the things that are creating your presentation, like what are the roots happening underneath the underlying concerns that are presenting as issues for you, you may want to go with a more traditional therapist versus a counselor. A lot of times the therapist is going to process through with you on a lot more of those things. So that's our video for today. Those are your designations. Those are some of the, separations, the myths, whatever misconceptions around some of the mental health professionals. I hope this was helpful for you. Again, thank you for watching, viewing, sharing, liking, subscribing to the channel. And I hope I see you again soon. Until next time, be well and be very blessed.